Okay, I've joined the ranks of how many times do I have to do this in order to know what 10 minutes is. I guess I need a timer, although I'm at work, so there must be a timer somewhere. Oh, there's a timer on my phone. I should have used that. Anyway, I was talking about the hospital, leaving the hospital. I think I was pretty much done with that. I had my drains taken out Friday at noon. They said if I could get over to their office and check out of the hospital and get over to their office by 12, they would accommodate me and take my drains out instead of the following Monday, which was great. Um, and of course, checking out of the hospital quickly is kind of like pushing a rope. It's virtually impossible. But I kept saying, okay, 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 I got it, okay, I'll read it, I promise to read it, I promise to read it, just get me out of here, just sign, I just need to go, I just need to go. So it was a rainy, gloomy day, and if I could have put a motor on the back of that wheelchair to wheel me out of the hospital room and down to the front entry and got me into that car, I would have done it. Anything not to have to worry about coming back from my friend's house. My friend is about 60 miles from my house, where I was going to go to recover. So I was anxious to get there, get settled, and it was raining, the worst raining day all winter, of course. Southern California were totally in drought conditions. It was rain. It was really raining. So my girlfriend doesn't like to drive in the rain. She has a husband. He drives. What can I say? I would have driven if she would have let me, but she wouldn't let me. Anyway, the last thing I did before I left was take out one of those little pain medications, and they come in those little coffee creamer containers, the one where you peel the lid off, little triangular thing. And so that's the last thing I did before I left the hospital was do that. I figured in 4 hours I'd be back at her house, which I was. So I went over to the doctor's office. They had two drains in me. One for, one was not a drain. One was a reverse pump so that it pumped pain medication into your stomach. And then the other one was the Foley drain, I guess it's Foley drain? JPJ, I don't know what it's called. Anyway. And they took both those out. I don't think they even gave me a Band-Aid. I think they put a piece of gauze and a piece of tape on it, and that was pretty much the end of it. I never had any problems with the site infections or anything. I was pretty healthy going in, and as far as taking vitamins and eating properly, I just ate too much. So I think that aided the recovery of my wounds. Plus, I'd been working on a leg wound that I've had for a while that I needed to get cleared up before surgery. So I was taking, and still take, zinc, vitamin D. I take my calcium citrate, Trader Joe's. And then I take my vitamins, and I take that sublingual B12 once a week. What else do I take? I think that's about it. So we'll see. My first testing for my blood is to see my blood levels of all the nutrients is going to be at the end of this month. I guess that's probably my 5-week checkup, my 5-month checkup, excuse me. And they're also going to do a bone density test at that point, which I thought was odd, but he said it's going to be like a baseline test. So I went to my girlfriend and her husband's house and anticipated staying. I went there on a Friday. I anticipated going back to work on Monday, so I figured that by Sunday they were going to have to take me home. There's no way. That surgery kicked my butt. It really did. I don't know if it's my age, if it was losing so much blood and then having 2 blood transfusions. I don't know what it was, but I do know that I was in no condition to go back home that week or even the week after. So a total of 3 weeks, then I went home. I had a little bit of an anxiety attack leaving their house because I didn't know what my life was going to be like at home. However, I have great neighbors, and it was kind of when they took me home, they turned me over to my neighbors, and my neighbors there were in charge of the care and feeding of Ruth after Greg and Shirley were the care of feeding of Ruth. So that worked out really well because they ended up, going to the grocery store for me. They cleaned out my cat box. I think they even changed my sheets once. They were just great. And I don't have any family in the States, so they're like family. I mean, my friends are like my family. So my biggest issue, I had 2 big issues. One was pain. It's kind of hard to remember at 20 weeks. I think it's kind of like having a baby. I've never had a baby, but it's kind of like you kind of forget the pain. but I did have, they told us that they would give us this big old bottle of medication, of pain meds, which they absolutely did. And I ended up having 5 of those bottles, which was, I think 6 bottles. And then after that, they said I was going to have to see the doctor. Initially, I took it every 3 to 4 hours, and then, but very, very quickly, I went down to twice a day, like in the morning when I got up, and then at bedtime. And, but I had to have those 2, and then I took out the morning one, and then, but I had to have the one in the evening before I went to bed. Actually, I'd have it about 7:30 at night. The other thing was, and this started about 3 weeks or so, I had intense nausea, and it would be when I would get up in the morning, and it would be, I would put my legs over the side of the bed, and I would want to throw up, and I would think, oh, I got up too fast. I would try to get up more slowly. I would try to creep out of bed. I would try to crawl out of bed. I would try to like inch out of bed. Didn't make any difference. I was still extremely nauseated. I ended up asking my doctor, is there some kind of nerve that goes from your brain into your stomach or something that causes nausea? Because I know, you can get nauseated from an inner ear infection or something like that, but I never had this kind of nausea where I couldn't even move. So I'd get up in the morning, I'd go sit down in a chair in the living room and pretty much park myself there, except for doing little things until the nausea would subsided every day. Then I would, initially it was like 1 o'clock in the afternoon, and then I would get up and I would shower and I would go to work and then stay a few hours and then go home again. Well, at 8 weeks, and I read the Karen Feeding, that Dummies book, not the Karen Feeding, the Dummies book for gastric bypass, which I would highly recommend. And, it said if you have nausea, it could be from this, it could be from this. Try protein, maybe you're dehydrated, maybe you are, this or that. So I tried toast, I tried protein, I tried water, I tried so many things, and none of them seemed to work. I honestly think that it was nicked, it was jostled, it was bruised, it was something, and that's what caused me nausea, because at 8 weeks, on week 8, one day I was nauseated, the next day there was absolute absence of nausea. It was like freaky. And then the day after that, I had nausea again. The day after that, I had no more nausea, and since that time I've had no more nausea. So I honestly think that something was bruised, and that it took that long to heal it. But once that issue was over, and the pain medication thing, I had a problem with the pain meds, but I didn't realize that either. Turned out that the pain meds that I was taking had a lot of Tylenol in it, and Tylenol does not agree with me. And it had said to me, the nurse had said to me, that pain medication causes pain. I didn't understand that. I'm not so sure I understand that now. But having the Tylenol not agree with me means that I then had pain, and my pain was actually caused by gas in my stomach, which wasn't really in my stomach, it was in my intestines, which the doctor also explained to me that, usually the digestion of the food prior to this has occurred in your stomach. Well, your stomach is so small, it pushes the food into your intestine, then that's where it starts to break down, and that creates the gas. So go out and get Gas X, and the strongest one you can find, and take it while you're eating your meal that causes you gas, like, whatever the food is that causes you gas. And that within 72 hours, I was cured of, my stomach ailments that I was having. So the time is almost up, so I need to think about, can't believe it, another video. That's what happens when you don't do a video. That now you have multiple videos, duh. So anyway, let me stop here and get back.